Health services research is so important because it is generating the evidence that's used to guide action both at the policy level and as we understand how health systems are making decisions about how to deliver care.
In almost every country, the need for healthcare is increasing. Aging populations, discovery of new but expensive technologies, and so we really need to spend that money the best way we can. And the only way we're going to do that is to find more evidence on what works well, and what doesn't work.
I think it's the most critical type of research because it impacts such a huge fraction of the economy and impacts our understanding of how to best take care of people every day.
I think what brings us together is the mission to improve healthcare.
Well, health services research to me is about how can we better deliver care to the right patient at the right time for the best possible outcome for them and for the people delivering the care.
The health system faces so many challenges, particularly in rural and remote areas where we have small dispersed communities and not enough of the health workforce and people with enormous health needs. I think through bringing all those people together, we can make the system work better for everybody.
Inefficiencies in care, patient safety issues, establishing good relationships with consumers. I think there are lots of opportunities in all aspects of healthcare where health services researchers can contribute.
I think the biggest challenge for health services research itself is also the question of funding. I've been speaking to lots of people at this conference who have great ideas about the kind of research they want to do to improve the healthcare system, but it's getting the money to do it. And I think we all realise that money is very difficult these days for any endeavour, but I think health services research is so important that we should try to make the funding available when we can.
For me, one of the interesting challenges is how do we get scale and impact from some of that research while also keeping it personal and keeping it connected to the individual circumstance of the patient.
Key challenges for health services research today is how to ensure that our research leads to action, how to not just document problems, but also to show that there are solutions out there that can work in real-world settings.